can't.
I'm recording this. Yeah, that's fine. Okay, so let's start with the lecture today. Any questions, please let me know in between. You can interrupt me and ask me if you need clarification on any point. So we're talking about working in health and social care, and we're understanding the use of effective communication in health and social care provision. Appreciate the fact that you try and join every weekend. Obviously, we have yeah, it's highly appreciated that you're there in the online lectures, which is the main objective of our teaching, that it should be, if it's not face-to-face, still that interaction should be there. It's so important, instead of just watching a video that's recorded. So without further ado, we'll go into the indicative content. So this is to understand why effective communication is so important. So we'll talk about how communication takes place, why is it so important again, and what are the different ways in which we can communicate with different people, with different different people impacting on our everyday life or the work that we are doing. And we'll talk about certain ways of, like, what are the barriers in communications. Several barriers that some of them we might know, some of them we'll become more aware of. Data protection, we've been talking about this, we'll talk about this again. What's the purpose of information? How can it be shared? So I understand this is a very important session today. And if time allows me, I will try and cover all the topics in an hour's time. But if it does not, if there's, I think we'll have to split this presentation into 2 parts. So I might have to like go through some topics with you tomorrow, if that's okay. So yeah, so we'll talk about some key terminologies. So what is effective communication? So anything to be effective, it has to be, effectiveness has to be measured in qualitative or quantitative terms. So in qualitative terms, if you measure effectiveness, how, for anything in general, that objective. So that is how it's called effective. So, so in communication, again, the aim is to be heard. So if there's a person who's communicating, that person wants to be heard by someone. And and in the other way, when you're receiving information, you want to receive proper information, the exact information. Obviously, nothing else but the exact information. And that is so crucial in so many instances. Let's take an example of healthcare itself. So how does it work? So there's a sender who gives a message, and that message is then encoded. So that sender has codes or a language that is used in that message. That message goes to the receiver, and the receiver receives that message and gives a feedback. This is called decoding. So the message is decoded by the receiver. So if this message is not at the level, so if the sender is sending a message to the receiver, if it's not at the level, this message is not at the level of the receiver, what will be the feedback? It won't be good, obviously. It's not going to be positive feedback. So you want positive feedback. So let's say you're giving, you're delivering a session, a healthcare session, and you want feedback on that session. What will be the feedback if you're giving that in a language that the receiver does not understand, or if you're using that language but it's not clear enough, you're using jargons, let's say, you're using terminologies that are not being decoded by the receiver, the message cannot be understood. That decoding means an understanding of that message by the receiver. Obviously, you're not going to get feedback. This feedback is very important for the sender, and then the sender also can send feedback to the receiver. So it's both ways. This feedback works both ways, and it's very important to understand this very important process. So for effective communication, there are different factors that impact effective communication. So it's your verbal, non-verbal communication. So certain gestures that you make, even if you're very good verbally, if your non-verbal gestures, like you look impatient, or you seem to be in if there's a patient come to you and you're constantly looking at your computer or at your mobile phone, or you're with sorry, or you're engaged in other work, that's not very effective communication. So when you're speaking to someone, or you're dealing with anyone in life, that person should have that feeling that you're giving them the time that they require. It's not easy for everyone to come to you at the specific time that you've given to them. And obviously, there are people who have several responsibilities. Keeping those in mind and still coming, it's hard. And then you have to clarify your messages. You need to have proper eye contact with them. That is so important. Empathy is very important. Empathize with them. Understand that if they've come with difficulty, it is a difficulty. It's not hard to empathize, but it is hard for, it seems weird that people do find it hard to empathize with others. But when you're in healthcare, that is one very important requirement to be a good healthcare professional. Your tone, your pace must be very well kept. And you shouldn't have a loud tone. A subtle tone will do. Your pace should not be very, very fast. Now, by pace, I mean that you might have a patient who's speaking very loud, or a patient who's speaking very fast. Now, speaking loud can be because of different reasons. It might be because that patient can't hear you properly, or can't hear at all properly. So that patient might be using a hearing aid, let's say. In that instance, obviously, your tone should be different. You might not even have to use your tone. You might have to use different sign languages. And your content of speech, as I said again, you shouldn't be using jargons. You should be using proper terminologies that are clearly understood by the receiver or the service user. And your facial expression, how close are you, how are you seated, that is so important. So in healthcare, as we say, that your sleeves should be above your elbows. So that shows that you're ready for the patient, you're listening to them. That is a gesture. So these non-verbal communication gestures, they're really important. And active listening should be there. While you're listening, you should only listen. You should not be adding to anything that they're saying to. And that adding can be there, but at another point. So give that some time. So effective communication, it's a set of, let me just put my annotations up. Yeah. So it's a set of, it helps, it's very important, and it helps both care workers and the people who are using their services in order to form good relationships and to work well together. Because if they have to work together to achieve that objective. And people communicate very effectively when they're relaxed. and when they're able to empathize. So your communication will be very good when you're empathizing with the other person, with your service user. Uh, and vice versa. It's not going to be really good if you don't empathize, you don't have that empathy, or you're not relaxed yourself. You don't have, obviously, you can't actively listen to someone if you're not relaxed. And you experience warmth and genuineness in the relationship. So these are very important. Go at the level of the patient. You have to go to the level of that patient. Effective communication requires the care worker to develop and use a range of skills, abilities, and communication techniques. So no matter how excellent your procedures and processes may be, your AI might be excellent, might be your artificial intelligence, it might be working wonders, but that human touch, if that's missing, it's of no use. AI can't produce stuff that we humans produce. There is always going to be an element of the human touch that will be missing, that human. And I don't change my statement. I've heard a lot of people saying that, oh, AI can do this and that. AI can't empathize with patients. So always remember that what your strengths are, always build upon those strengths. That was just something out of what we're talking. So the second point would be to describe the role of communication in health and social care. Now, if you see this lady, she's there, the way she's seated, she's a healthcare professional. So the way she's seated, it seems that she's actively listening to the patient, writing down points, but those points should not be interfering with what the sender or the service user is saying, or what the patient is saying. So because at times, if we're writing too much, we're writing too many points, it becomes hard for that person to communicate with us, and they're just thinking that you're just writing down your notes and not listening to them. So that active listening should be there. It has to be there throughout the process. So healthcare providers, they interact with patients with physical or mental illnesses, and social care providers interact with people who are vulnerable and may have physical or mental ailments, along with interaction among health and social care providers. So communication, as I said, it's only effective when you are in a secure environment, and you understand each other, and you're able to receive, understand, and respond to the sender. So that is only possible when you listen, when you're actively listening. So according to Cypher Health, it is very important that that communication remains in place, in the form of follow-ups, in the form of change of medication, so that interaction that doesn't end at that very time when the patient has left. No, there has to be proper documentation, because this should remain in your will remain in the records of the patient. Again, if the patient is speaking about abuse or any other thing, these need to be there in the patient's file. So if you're communicating with a person, with a service user, you need to update on their medications. If there's any reporting of abuse, you need to report that to the authority. And any other whistleblowing, if that's required, that needs to be there. So CPD Online, it plays an important role in recovery and well-being of service users during the past 3 decades, as studies have shown. So it's very important to know that if you have the ability to listen and you have the ability to explain, what difference does it make in the life of a patient? Let's say there's a healthcare professional who's working with a patient with mental illnesses, sorry. So a person with a mental health impairment would only want to be listened, would want drugs, but wants to be listened to a greater extent. That is why we have CBT sessions, so cognitive behavioral therapy sessions, in which you listen to that patient and that patient pours their heart out to you. And that would lead to satisfaction. The only aim of these CBTs, and obviously a psychiatrist will prefer giving the proper medication, but if you're not speaking to that patient, it's of no use, that medication. So that is why we try and keep it hand in hand, CBT as well as medication or talking therapy. The service users, the family members, they feel empowered because we are helping them participate in the information sharing. Treatments can be planned, and you can make them, they have the confidence that they have, that their health is to a great extent in their own hands, which makes them responsible people. The message needs to be simple, clear, transparent, so there's no message that's hidden from them. And their family members need to know also. So if there's something that the patient doesn't want the family members to know in terms of confidentiality, and the patient themselves have full capacity, mental capacity, they're fine enough, and you assess their capacity, that they have the capacity to declare their wishes, then that should be taken care of under confidentiality terms. Again, there's a relationship that is only improved by good communication skills. So when you're having these good communication skills, obviously it's through different ways, through if you're an employer, you're doing it, or if you're a leader in any organization, you're doing it through emails with your colleagues. So it's not just communicating with your patients, it's also a communication, effective communication with your colleagues. So, okay, and then they work better as a team. But there are conditions that make it hard for your patient to understand what you're saying. For instance, there's a case of brain damage, language barriers, limited literacy, can't hear well, can't speak well, doesn't have the confidence to speak, is too, the patient is too distressed to be able to speak. So you need to have different things in place, different strategies, tools, and techniques to be in place. So for instance, you have translators, you have pictures. Sometimes we don't have a translator for a certain language. What do? You have certain pictures to show to the patient, which are a very good depiction of what you want to say to the patient, actually. And people learn better when they see. So care providers, the different things that are used, different equipment that is used, different tools that can be used, and there's certain verbal and non-verbal communication skills that the care provider needs to know. So there's touching someone if they're comfortable with it, if there's someone who has a severe mental illness, and sometimes you may want to hold their hands if they're okay with it, considering gender and other norms, if they're in place and they have the consent. And then again, eye contact, facial expression. So if there's a patient who's not very clean, let's say, because of dementia, let's say, or any other illness, it's not very easy for healthcare providers also to be able to serve them and to be able to maintain our own whatever guidelines there are. But to your best of possibility, to how as much as you can, just keep a good relationship with them, whether it's verbal or non-verbal communication. So a care worker has to use both of these forms of communication, verbal and non-verbal, when they receive or give information about the care that is being provided to an individual. when they're giving emotional support to an individual or member of their family. So there's been a demise, and you have to declare that to the family members. How do you do that with care? Obviously, mm, that human touch is very important. And carry out an assessment of an individual's care needs. That is also very important when you're communicating with the patient. And then, let's say you're examining a patient, you're checking the pulse of the patient, or you're checking their blood pressure. Everything counts, everything. So if the patient is not aware, has dementia, let's say, but there's another person who's with that patient, so they would be aware of what has happened. To be just be careful of how you're treating patients. That is so important. Sometimes, obviously, it is hard for because obviously we are humans as well, but we need to communicate this also. So unless we communicate this and speak up about our difficulties that we are facing in any of these processes, um, only then it becomes easier for us. So here I'm explaining the methods of communication that are used in health and social care. So there's verbal communication. So you have telephonic conversations in which obviously and face-to-face interactions. So these are time bound, obviously. But even if you're talking to a patient for 10 minutes, that communication should be so pleasant with that patient. Half of that patient's ailments are cured in that way, and it's not wrong when it's said that the words that you use have a very big impact on your patients. For instance, if there's a person who's communicating with you regarding their mental illness, and you're not there, you can't offer support. If you can't offer support to them at that time, so that it's like they have to go through certain assessments, or they don't have uh, uh, they're not getting the appointment when they require, and you can't get that for them. But still, if you're communicating this in a respectable manner, in a manner um, that doesn't impact their dignity in a negative way, that can have such a big impact, such a positive impact on them. So yeah, and then you need to know your the languages that are used. Medical terminologies need to be avoided as much as possible. Then coming towards non-verbal communication, so it's important that if there's communication in healthcare, again, as I said, your body language, you have to have a smiling face. And if they're depressed, you need to have a composed face. And this is all training that's given to you, a proper training on communication skills, because it's so important. Sorry. And proper eye contact should always be there. Written communications, this should be in the form of records, formal communication through emails, preparation of reports, dissemination of those findings. Written communication has to be used in health and social care sectors. So you're writing down whatever interactions have been there, and yeah, and whatever's important, you need to write it down. Then we come to British Sign Language. So this is an important need for deaf and blind people, and we have new techniques that help in better communication, so that they don't have this disability of theirs does not impact the care that they have to be provided with. So artificial intelligence scientists, they're developing technologies that enable blind people to see to a large extent, which is something that is great. Yeah. So we have to talk about things that are great, and we have to accept them, not just um, canceling them and thinking of them as negative. No, if there's something that's happening in our interest and it's good for us, we are happy to more than happy to accept it. We should be more than happy to accept it. So, but it's important to understand that deaf and blind people develop communication over a period of time. They might not have they might not have these resources, and these technologies might be there, but they're not willing to adopt to these new technologies. It might take them time because some people remain deaf or blind forever. So it takes time for them, and then give them that time. So human aids are also used apart from whatever other technologies are in place. And so you have interpreters. So when there's a communication barrier, there's another person who interprets whatever the doctor, whatever you are saying to the patient, and the patient, whatever the patient is saying. So there's a common language between the patient, you, and the interpreter knows one language uh, in which that person communicates, the service user communicates, and then the interpreter also communicates this to the care provider. This is for translators and interpreters. And then signers, they use forms of sign language, and with what has been said or written into a sign language is communicated through a sign language. So that's known as Makaton or British Sign Language. So these signs and symbols, they're very important. They're different ways of showing. So it's a whole science in its own. So this helps people if so the service user will know to a greater extent of the sign language, but there's a possibility that you don't know that sign language. So you will need a person who knows that sign language to interpret it to you. So then there are objects of reference. For instance, there are toys, clothes, jewelry, um, or anything that has a special meaning for someone. So for instance, for a child, if there's a cuddly toy that shows that they're comfortable and they're safe. An older patient may treasure their photographs because they represent and provide memories of families. So there's certain things that you could see in the patient's hands that show you what their priorities are. And these things can also be kept for that patient. For instance, if there's a child and you have toys around, that child would find it um, easier to communicate with you, um, considering it's a safe environment for them and it's a comfortable environment for them. And there are certain aids by technology. So there's electronic communication, hearing aids, video phones. These are again to help disabled people to have better communication. The non-disabled people also who use technologies in like mobile phones, texting message through messages and emails to communicate with others. So their websites, different social media platforms that can also be used to communicate between people. So let's say you have a group on Facebook where you have all your patients there, and you're providing some new service, so you can just put it up on Facebook, considering that they don't use their emails and they're more used to using Facebook. Then we talk about barriers in health and social care. So there are several barriers, obviously. Some are obviously very major barriers, and some are minor barriers, which if they continue for a long period of time, they may have a tendency of becoming major barriers. So we'll talk about these barriers in detail. So it's the condition of the service user. So um, it may be one of the main major barriers in communication. So the person can't hear you, or the person is blind, and you don't have equipment, or you don't have means to provide information to them or take their information from them. So it becomes one of the major barriers, and it's only possible through different aids that we've talked about earlier. Competing demands. So there's health or social care, or health and social care practitioners. So they have competing demands. They have communication barriers that may rise because of this. So what I mean by competing demands is that um, there's certain demands that are there. Um, so you in because of that, let's say there's a demand of just seeing a patient for 10 minutes, and you do not have that time. So you've been given a time slot of only 10 minutes to see a patient. That demand of that just 10 minutes and not more than that time being given to that patient can have an impact on your communication. So you need to be aware of if there's um, such a demand that could then lead to, like for instance, if I'm communicating to you, I'm just giving an example. If I have this in mind that I have to complete this presentation in just 40 or 45 minutes, and I have 40 slides to cover, um, or I have, let's say, just 30 slides to cover, and I have just 30 minutes, uh, or let's say 40 minutes. So for me to convey a message to you, it might take a lot of time. Considering it's there's some things that can happen better in a face-to-face environment, and some things that take are better when they're on telephones or online. So teaching always happens best if it's face-to-face, obviously, because you're seeing gestures, you're seeing different other aspects of teaching, and the support is that the support is better. But then considering different uh, uh, barriers that you have there. So for instance, you can't come for face-to-face lectures, or I can't make it for a face-to-face lecture. So that is why we're making it easy for ourselves, and we're going through the internet. But then the internet, if I know that my lecture can only have a span have only have a duration of 1 hour, I would then just read through slides and make it as fast as possible, but the objective is not achieved. Then it's of no use. That 1 hour goes to waste for you, for yourself, and for me. And it's the amount of uh, time and the resources. So you have, like, the listener or the person who's listening to me, they have a family that they have to look after. They're putting those things on the side. I'm putting the things on a side, and I'm communicating to you. But that communication can be of no use if there's an increased demand on me to complete the task in a given set of time. So this is what it means. So then there's lack of privacy. So the patient may hesitate, and they might not want to explain their problems because they don't have the privacy around them. So always make sure that the curtains, if there are curtains, there should be a proper barrier around the patient. Um, and they need to make sure, you need to make sure that they understand that their privacy is respected, and that their information would not be shared, so that they communicate best to you. Then there is the problem of language. Again, you need a proper translator to express whatever the patient has said. In gender, that must be, it's sometimes difficult for a person, for instance, if there's a patient who's seeing there's a female patient who's seeing a male gynecologist. It's hard for her to express all her the problems with her. And then for that instance, it's only in certain cultures, not in every culture. So in that instance, it would be best. So it's not that that patient might not communicate at all, but it's not the ease with which that communication would occur. So in that instance, it's best to have the same gender, uh, if that's possible, only in those instances. So there are certain factors that impact uh, communication. So if you're using jargon, slangs, you're using different acronyms, you're using, there's sensory deprivation, there's any disability, cultural differences, the environmental problems, so there's not proper hygiene where you've placed the person, or there's not proper privacy there, the people coming in and going, the language differences, health problems, the dialect that you're using, the different emotional distresses from the patient side. These are all going to impact your communication. And then if you have poor communication skills, whether verbal or non-verbal, that's again going to be a big barrier. Now we come to information handling and recording procedures. So it's very important to know how to handle different information. So some information is going to be very confidential, and then that privacy needs to be noted down, and then it cannot be shared um, with anyone, only with those people who it has to be shared with. So, and the wishes of the patients need to be, you need to be aware of them, and whatever they want confidential or want them to be shared, that should be respected at all times. And then you need to understand the human rights legislation, the Human Rights Act that respects private and family life, the Care Act 2014 that keeps patient at the center um, in their approaches, and Health and Social Care, in which there's Service and Quality Act. It integrates information related to service users. Data Protection Act 2018 provides related, it has provisions related to employees and service users in certain care settings. You have to access policies. You have to be aware of policies. So your data has to be kept confidential, and it's some place that not everyone has access to, or it's only this care provider that has access to, or anyone or any other person who is concerned with that case. So if you have an access policy, the confidentiality can be maintained. So doctors may give full access to patients' records and reports, while nurses have access about line of treatment or prescription. So not everyone has access to everything. So that is the access policy. So need-based sharing is very important. So whatever is needed to be shared, that information can go out to wherever it is required, after taking consent of the patient. So the patient needs to give an informed consent, not just a written consent. It should be informed to the patient, and then the patient can give a consent or doesn't give a consent. It depends upon the patient. You need to make the patient aware of what the information is it that is being shared, and where would it be shared. Service users don't understand their family members. So if there's a person with dementia, uh, sometimes, as I said about capacity, so those people, if they don't have the capacity to share information, that has to be noted down again, and that information then would not be shared, or if it is shared, it would be under proper guidelines and proper procedures. Confidentiality, we talked about it previously also. It is something that needs to be made. The service users, they should be assured that whatever is being shared, it is confidential, and it remains their property. And would not be shared with anyone unless they require it to be shared. There's a member of the care team who should share confidential information whenever it is needed. This is for safe and effective care of an individual. So it's for the benefit of the community. So let's say there's a person coming with HIV and is infected. So that patient, if that patient is a threat to infecting others also, obviously through certain procedures, it's not by a simple touch, but if that person, let's say, is a sex user, let's say, is has this is their employment, this employment status. So is it that this information, if they require it to be confidential, having that condition, would you keep it confidential or would you share it for the better protection of the others who could be impacted because of that illness, which is obviously an illness that cannot be taken not seriously. So if you're working in health and social care, it's important that you understand your duty of confidentiality and you must abide by it, but then it should be in the best interest of the patient and to the larger community. So it's about privacy. Confidentiality is all about privacy, respecting the patient's wishes. Professionals shouldn't share personal information about anyone with others unless that person has said that they can or it's absolutely necessary, as we've talked about earlier. Professionals, these include doctors, nurses, social workers, support workers, and employers. So in a health and social care setting, confidentiality will mean that the practitioner should keep a confidence between themselves and the patient. And this should be part of good care practice. This means that the practitioner shouldn't tell anyone what a patient has said, and their details um, cannot be mentioned to anyone. This includes not showing anyone other than whoever needs it, an individual's personal notes or computer records or anything else that the patient has shared. So what legislation covers confidentiality in health and social care? We'll talk about a bit about it. So there's a common law of confidentiality, and this is broadly taken from common. This is it's a common law. It's a duty of confidentiality. So it's important for encouraging people who come forward with issues and concerns. So there's certain offenses and provisions where this duty of confidentiality is overridden. So, for instance, if there's a victim of female gender mutilation, it's a criminal offense, as we all know, and appropriate authorities need to know. So there's a patient who comes with this problem, who talks about this problem. But then this is a serious concern, and then you need to breach that confidentiality. It is your duty to share this information to keep people safe, but then again, letting the people know who need to know. Human Rights Act. So it gives every individual, it came out in 1998. It gives every individual the right to respect for their private and family life. And this also includes having any personal information that should be held in confidence. So this right is not absolute, and this can be overridden also, again, if there's any safeguarding concerns. The CARE Act 2014, it encourages caregivers to take a person-centered approach when they're safeguarding vulnerable adults. We've talked about it earlier a bit. It sets out a new way of thinking that's in relation to adult social care, and it explains the importance of sharing information at early stages so that people stay safe. Then there's the Health and Social Care Safety and Quality Act 2015. This sets out a number of provisions that relate to health and social care services in England, and it covers the integration of information relating to users of health and social services. And it also talks about how information should be shared and those people who need that information, how would it shared, who would it be shared with them? The Data Protection Act, we've heard about it a lot. When we are signing our contracts, we have that, and the GDPR also. Uh, and they have provisions which explain the way organizations, different charities and businesses, they're handled in different ways. So this would include care settings and provisions relating to clients, patients, and employees. So under this act, the personal information must be processed lawfully, fairly, and transparently. It's collected for specified, explicit, and legitimate processes or purposes. There's adequate, relevant, and limited information to what's necessary for the purposes of why it was collected. It's accurate and up to date. It's not outdated, and it's not going to be kept for longer than it's necessary. So it's not like when decades go away, and then someone is using without letting the other person know. It's processed in a manner that is within appropriate security, and it's protected against accidental loss. When can you break confidentiality in health and social care? So there are different people who come to you and ask you to keep their information confidential, not share it with anyone. So when do you keep it confidential, and when are you required to break that confidentiality? So the simple answer is that you may, in certain instances, override this duty of confidentiality to patients and clients if the sole purpose is the best interest or the interest of the public. So you have information that suggests that a patient or a client is at risk or harm. So that you think that they might harm themselves, you need to inform authorities, or you need to inform their family members that they're at a risk of harm. You have information to suggest that a patient or client is posing a risk or of harm to someone else, that needs to be, uh, so it's again in the best interest of that patient and to the public. So you should always report your concerns. Yeah, hi, sorry for that disturbance. So in these instances, you should always report your concerns to your manager or your supervisor, and to help uh, contribute in any further actions that have to be taken. This is in cases where you think that there is a risk to the patient or to the others who around those patients. Um, and then we come to a we are considering an example where you're overriding confidentiality. So you're a care worker. I think after this scenario, we'll close the session, if that's okay, and then we can continue tomorrow. So you're a care worker, and you have gone to assist an elderly male at his home. You don't usually assist this man, but his usual care worker has gone away for the week. When you're helping him to get dressed, you note there's several bruises on his back. And when you inquire, you say that his usual nurse attacked him last week and caused the bruises. He also believes that he said something silly because the care worker started calling him names and then started hitting him. You are very concerned, obviously, and when his normal care worker returns, you're concerned about what happens then. He tells you that he doesn't want to tell you to tell anybody because the care worker is usually nice and it was just him making a silly comment that caused this to happen. He's upset now, the patient, and he doesn't want to get the care worker into trouble, and he doesn't want to get into trouble also. So there's conflict over here. You believe that you should inform your manager immediately and report to the other staff members. However, the gentleman has taken you into confidence and has begged you. So you don't want to breach that confidentiality. So what do you do in that instance, Placidia, if I ask you?
Okay. That's obviously safeguarding. So
Yes.
I would write it on the daily note. I would write everything that happened in the conversation. I
Mm-hmm.
would call my line manager and notify my line manager that this is what has happened so that they can also look into it.
Yes. So obviously this and your basic aim is that this should not happen again. Thank you, Placidia. So in this situation, it is acceptable to override your duty of confidentiality, as you just mentioned. And your basic aim, your basic objective is to protect the man from further harm. You should explain to him, but he needs to know that you're going to override this, his confidentiality. Um, you need to explain to him that you understand, you know why he is upset, and you know why he doesn't want to speak out. But then you want him to know that you're there to protect him. The organization is there to protect him, and there is in no way that his confidential his he would be harmed in any way. So that is what your main objective should be. You're protecting him from further harm. So you're acting on behalf of the person's best interest, and this is within the Public Interest Disclosure Act. So this means that you can override your duty to protect his confidentiality and speak to your manager about whatever the findings are. So there are five. There's some factors that you evaluate that can influence the maintenance of confidentiality in health and social care. So there are five confidentiality rules basically. Number one, you ask for consent to share a certain information. You are considering safeguarding again, as you mentioned. When you're sharing information, you're being aware of the information that you have and whether it is confidential or not. You're keeping records whenever you share confidential information. So record keeping is very important. Um, this is for every instance that you have. Be up to date on the laws, know what the laws are and the rules surrounding confidentiality. So how do you maintain confidentiality in the NHS? You need to make patients assured that their whatever information or whatever interaction that's happening will remain confidential, and respect that you're giving to the patient or to the service user. There should be a member of the care team, as I mentioned earlier, who should share confidential information when it is needed. This is for the safeguarding purposes. Um, Care of the individual, as we mentioned earlier, the example. Information that is shared for the benefit of the community should be anonymized. So sometimes you need to protect confidential information. If you regularly handle confidential information, you need to take steps in order to ensure that you protect it adequately. So you're ensuring that confidential information is always locked away. There's no one who has access to it, not left unattended during the day, even if they're small notes written down. Those notes need to be kept under lock and key. So if you have any confidential information that does not require sharing, you should not share it. Password protection should be there for sensitive computer files, marking confidential information clearly as such, and ensuring that paper copies are shredded in a shredder before disposing them off, and ensuring that you only disclose confidential information to those who need it, not to the entire whoever needs it should have that information. And at last, we are talking about evaluating strategies that are used in health and social care settings in order to overcome barriers to communication. This is the last slide that I'll be sharing with you, and then we can speak about it in further detail tomorrow. Uh, so, so there are barriers. When you have barriers to communication, they can be overcome by checking whenever it is a good time and place to communicate with the person. So at that time, maybe that person um, does not have capacity to communicate with you. Ask what is the best time and place for that communication to happen. Being clear, using language that the person understands, communicating one thing at a time. That is very important. So then there's some people who can't absorb all the information that you're providing to them, and then um, they need space in order to process whatever information is being given to them. Respecting a person's desire to not communicate, again, confidentiality. Checking that a person has understood you correctly, and communicating in a location that is free of distractions. Again, their privacy needs to be taken care of at all times. They need to make sure that you need to make sure that that is in place and that breach has not happened. And then this is how they communicate to you effectively. Acknowledging any emotional responses that the person has to what you have said. So you should be ready for that. They might have an emotional way of processing the information that you've shared. For instance, if you shared some bad news to a person, how are you expecting them to process that information? And if obviously you need to have things in place if they're not able to process that without an emotional response. This is for not just the patient itself. This can also be for um, uh, the um, the support that the patient has or the family members that the patient has. So these things need to be taken care of whilst you're um, providing any information that could have an emotional impact on the patient or their loved ones. So that's about it. Stopping sharing here. Any questions, Placidia? I'm happy to take.
Yes.
Yeah.
It's a very clear topic and very common one in the industry. So I
Yeah.
really do understand this. But the part where where you were talking about the scenario and you said that you have, after the person has told you to make it confidential and not disclose it, you still have to tell the person that I have to disclose it. There was an instance where I had an experience where after the staff told the resident that I would have to disclose it, then the resident decided to change the story. She said nothing happened. So what do
Mm-hmm.
you do in that kind of scenario?
Um, so I didn't get your question, sorry.
So the
Can you
thing
repeat
is,
it? Mm-hmm.
you know that, yes, you have to tell your manager so they can deal with it, and follow all the
Mm-hmm.
steps. But
Mm-hmm.
there's an experience I've had that when the staff said, I am going to have to tell somebody in order to protect you and keep you away
Mm-hmm.
from harm, like trying to
Mm-hmm.
get consent. I
Mm-hmm.
think that consent is ultimately, I don't know if it's yes, you might try to get it, but I don't know if it's compulsory that you have to get that consent, because this instance I'm giving you, the resident
Mm-hmm.
changed her story after the
Mm-hmm.
staff told her that I must tell somebody. She said, okay, nothing happened. So when the assistant
Mm-hmm.
manager came after it was being reported, she said,
Mm-hmm.
I never said anything like that. Nothing happened. I don't know. She's making up stories, even with all the body maps and
Yeah,
everything.
those conflicts do happen because we are humans. Actually, we have to accept this that if the patient is not willing to share something and is afraid of sharing something, then that is why note taking and keeping records is so important. So if you have the proper records there, your manager obviously will have gone through certain instances. Again, you've given me an example. Now I have your example, and then your manager might have millions of more examples in his workplace or in her workplace, and they'll obviously want to trust the service user, and they will understand what the fears are of that service user or that patient. Those instances again, um, it's obviously up to the manager, but in you're considering of you and of the public as a whole, you should be able to share that information only with the relevant people. So if there's a police case, for instance, if there's any case that you're thinking that there is a threat to anyone, then that has to be shared. Yes.
Yeah, so if I was the manager, would I make my decision based on, okay, let's say the person, the staff name is Tracy. Would I make my
Yeah.
decision based on maybe Tracy has had other bullying or bruises report before? And if it was
Yeah.
Tracy's, if it was the first time Tracy was being reported, would I just write it down and not do anything? So how do I go?
As we'll talk about this in our tomorrow's session, I'll
Oh,
look this up also, and I'll research it a bit, and
oh,
then I can come to an answer for you. Yeah,
all right. Thanks.
yeah,
Have
yeah.
a lovely
Thank you so
day.
much, Presidia, for your question. Yeah, I'll
Yeah.
see you tomorrow then. You take
Bye.
good care. Yeah, bye. Bye.